Yes, we have showed another piece of what is already growing data, showing that in elderly people there is extensive clonal lymphopoiesis, specific mutations found in the B cell lineage. Now, importantly, in patients with Waldenström's macroglobulinemia, we showed that among these clonal lymphopoiesis, there is mutated MYD88, and that the mutation alone does not induce an abnormal phenotype. It is an intermediate step in between a random, normal result of aging, clonal lymphopoiesis, then MYD88, and then other genetic alterations that are critical for the development of a B-cell clone with a Waldenström's phenotype. These alterations were more frequently mutations in CXCR4, as well as large structural abnormalities such as deletion of 6q. So this highlights the value of these additional genetic alterations that are critical for the development of Waldenström's disease. And as a final note, we described that the mutation can be found in normal B cells, even immature B cell types such as B cell precursors, even in selected patients, CD34 progenitors, and then we ended up by questioning if the presence of mutated MYD88 in cells otherwise with a normal phenotype that cannot drive the progression of the disease may in some cases result in a false positive test when using digital PCR as a method for monitoring treatment efficacy in Waldenström's macroglobulinemia.